So, in today's lecture, I am going to discuss about the palmar palpation of wrist. So, we have already discussed in previous lecture about the dorsal palpatory technique. Now, I am going to discuss about the palmar palpation. So, basically, palmar palpation, again, let's start with the starting position. So, the all the position will remain same as we did for the dorsal palpation, except the position of the forearm. For the palmar palpation, the hand will remain in supinated position. मेन थिंग कि जितने भी लैंडमार्क हम आइडेंटिफाई करेंगे एंटीरियर रिस्ट पाल्पेशन में, इसमें ज़्यादातर लैंडमार्क जो होते हैं दैट ऑल आर सॉफ्ट टिश्यू लैंडमार्क एक्सेप्ट फ्यू बोनी लैंडमार्क जो कुछ कार्पल्स होती हैं. We can also identify from the anterior approach. उसमें कौन कौन से लैंडमार्क होते हैं? First is your pisiform at the ulnar side, hook of the hamate, again just distal to the pisiform. Next is your tubercle of the scaphoid and crest of trapezium. So these are the four bony landmarks which we can identify from the anterior approach. Rest of the carpal bone cannot be palpated, or it is very difficult to identify because of the presence of your thenar and hypothenar eminence. Because this area is very muscular, there are lots of muscle which cover this area. Apart from these four landmarks, we can also identify, and that is very important to identify the two more bony landmarks which is basically used for localization, that is your radial and ulnar scaphoid process. तो basically हमारा palpation start ही यही से होता है. So let's start with overview of the anatomy. We can understand the presumed anatomical location of these landmarks. Few landmarks are we can understand through this picture. Here you can see the first is the tendon of flexor carpi radialis. Second adjacent tendon is your flexor pollicis longus. Next is your palmaris longus, and the right tendon just adjacent to the palmaris longus, it is your flexor digitorum superficialis. And last tendon that we can identify is your flexor carpi ulnaris. So these are the tendons which we can identify very easily. इन टेंडन के अलावा कुछ और स्ट्रक्चर होते हैं, लैंडमार्क होते हैं जो हम आइडेंटिफाई कर सकते हैं, जैसे जो न्यूरोवैस्कुलर बंडल. तो एट द रेडियल साइड वी कैन आइडेंटिफाई द रेडियल नर्व, and the center just adjacent to the tendon of your palmaris longus and flexor digitorum superficialis, we can also identify the location of your median nerve. At the ulnar side, your ulnar nerve and ulnar artery. So, दो vascular और दो neural structure we can also identify. And next is your medial and lateral collateral ligament, or radial collateral ligament or ulnar collateral ligament. At the ulnar side, it is ulnar collateral ligament, and at the lateral side or the radial side, it is radial collateral ligament. So let's start the palpation. Again, these are the structures which we are going to identify, or we are going to discuss about the theoretical part, how to palpate, what is the requirement, and what should be the position. All these things will be discussed here. So first is, you can see here as in this picture, this is the location of your first tendon, that is your flexor carpi radialis. So flexor carpi radialis, tubercle of scaphoid, it is bony landmark, radial artery, flexor pollicis longus, again tendon, palmaris longus, again tendon, flexor digitorum superficialis, tendon, and flexor carpi ulnaris. This is the last tendon of anterior wrist. And pisiform bone and ulnar artery and nerve. So first start with the palpation of your flexor carpi radialis. What should be the position? First of all, you have to make a face like this and then flex your wrist like this and place your palpatory finger over the radial side, means over the lateral side of your forearm like this. This is the radial side. Or radially you just place your extreme or at the end of the radial shaft or styloid process and then slide it. First make a fist, flex and then slide your finger pad like this. You have to slide it toward the ulnar side and you can feel after making the fist and flexing the wrist, this tendon is basically bulging out and this will be the first tendon that you can identify very easily. So this is the location of your flexor carpi radialis tendon. If still you are not able to identify, one more adjustment you can perform. Just after making face and flexing the wrist, you just radially deviate your wrist and the tendon will bulge out. So this is the first tendon. Again the next tendon just adjacent to your flexor carpi radialis tendon is your tendon of flexor pollicis longus. You can see it is almost overlapped here with the flexor carpi radialis. So at the same location, but there is one problem. Because this tendon is one of the tendon which is the component of your carpal tunnel. So it passes just posterior to the transverse carpal ligament or your flexor retinaculum, just underneath to the flexor retinaculum. So it is little bit difficult to identify this at the wrist. So you have to slide it, your palpating finger, just follow the tendon of your flexor carpi radialis and slide your finger pad about 1.5 inch above the wrist joint. Means from here to here you just slide it and then again rest of the thing almost remains same. You have to make a face and then flex the wrist. This tendon of your flexor pollicis longus will also bulge out. So what will happen? You have to just separate or just try to identify two different tendons over here. One tendon will belongs or it is basically your flexor carpi radialis. Another tendon is your flexor pollicis longus. Now come to the next structure which is also found just adjacent to your flexor carpi radialis tendon, that is the location of your radial artery. So again at the same location, after palpating or after identifying your flexor carpi radialis tendon, just now release the pressure from here. You just apply a very gentle grip just before the location of your flexor carpi radialis tendon and try to identify or feel the knocking of the artery. So almost I can feel it over here. Almost this is the location of your radial artery. Again the next structure that we can identify with the help of the tendon of your flexor carpi radialis, that is your tubercle of scaphoid. This is tubercle of scaphoid. So just identify the tendon of flexor carpi radialis, then follow it distally and ultimately you will cross the wrist joint line and just distal to the joint line you will feel a small bony eminence or protrusion over here. So basically this is the location of your tubercle of scaphoid. Now come to the next structure, that is your tendon of palmaris longus. So for the palpation of palmaris longus, Even there is no, in most of the cases, there is no need to identify it with the help of palpation. You just make a face and try to flex your wrist like this, and you can observe in the center of the wrist there are several tendons which are bulging out at the in the center of the wrist or the anterior aspect. So basically, the first tendon which is bulging out from the radial to ulnar side, when you sliding further after identification of your tendon of your flexor carpi radialis, then flexor pollicis longus, and the next tendon will be your, that is palmaris longus. So just perform this, identify the tendon in the center of the wrist. Next, for clear cut identification of palmaris longus, you just ask the patient or subject to perform this movement, means opposition of your thumb and little finger. You may apply the resistance and ask the patient to apply or try to move the finger in opposite direction like this. So by doing this, again there will be more contraction in your palmaris longus. So because there are multiple tendons, so if you want to identify correct localization, so just ask the patient to perform this movement and just try to feel the contraction of the muscle or tendon. The tendon will become tense and you will be able to identify it very easily. So this is the tendon of your palmaris longus. And the next tendon, when you slide further, another adjacent tendon will be your tendon of flexor digitorum superficialis. But for the confirmation, again, you just make a face like this and place any resistance, or you can place your own finger underneath the, or just anterior to the fourth and fifth finger, and ask the patient to make a fist like this. Means you have to apply the resistance over the fourth and fifth finger. Means your ring and little finger against your ring and little finger. You have to apply the resistance and ask the patient or subject to make a fist. What will happen? Precisely, the contraction will occur within the flexor digitorum superficialis. So, by doing this, you can confirm the location or localization of your flexor digitorum superficialis. Again, you just move in the ulnar direction further, and then same thing, make a fist, flex the wrist, but here only one change will be there to identify the flexor carpi ulnar, is that you have to ask the patient to ulnarly deviate the wrist like this, and by doing this, your flexor carpi ulnaris tendon will bulge out, will become prominent. So over the ulnar side, extremely ulnar side, or you can start your palpation from the ulnar side. When you slide your thumb pad from the ulnar side, the first tendon which you can feel, that will be your tendon of flexor carpi ulnaris. So this is the location of your flexor carpi ulnaris tendon. Now come to the next structure, that is the location of your ulnar artery and ulnar nerve. So again, just adjacent to this tendon, both neurovascular structure found more ulnarly. So you just apply pressure from ulnar to radial side, little bit underneath this tendon. There will be very soft grip, and you just feel the location of the ulnar artery. And just against the ulnar side or ulnar stelloid process from the anterior side, when you apply the pressure, soon within few seconds you will feel the numbness and a different type of sensation over the ulnar side of the finger, and means in your ring and little finger there will be patient may experience some abnormal sensation. So, by completing your ulnar nerve, you can identify or you can confirm the location of your ulnar nerve. Now come to the next structure, that is the location of pisiform. So just identify the ulnar flexor carpi ulnaris and follow it distally toward the base of the wrist. Ultimately, you will reach over the pisiform bone. As we have already discussed, from the anterior side, it is the location of pisiform, and from the posterior side, it is your typhoid. So here it is a very prominent structure, bony structure that can you feel from the anterior side. When you further move with firm pressure over the base of the or over the in direction of your little finger, ultimately you will feel there will be uncomfort zone or a small bony structure is coming out, and if you are applying more pressure, there will be little bit discomfort or pain. Patient will complain of pain. So basically this is the location of your hook of the hamate. Same way, from after the identification of your tubercle of scaphoid, if you are moving little bit more distally with firm pressure, you can feel the crest of the capillary. So it's all about the anterior palpation of the wrist.